Good morning. Good morning, everyone. And namaste, aunties, uncles, friends, and allies. Welcome to another episode of My API Live, where you'll receive accessible, pertinent information from your host, 𝗙𝘁𝗵𝗶. I work for the Health Equity Unit at Austin Public Health. And we work to make our health services easy and available to all the communities who need it the most. Today, we'll cover a mindfulness technique to reduce daily stress, all the latest information on monkeypox, and updates on COVID-19 testing and vaccination. We have listed 3 telephone numbers for you to call, so you may listen to the show in other languages. To listen in Burmese, please call 512-768-8862. To listen in Vietnamese, please call 512-729-6206. And to listen in Mandarin, please call 512-846-7161. But before we get started, I'd like to bring your attention to our new look. Our hope is to continue evolving and improving for your viewing and listening experience. As our show continues to grow, our main goal is for everyone to easily access My API Live when it's convenient for you, and to rewatch it easily, and to also share this show with your family and friends. And to do just that, we're happy to announce that our show is now expanding to YouTube in addition to Facebook. As usual, we will continue to broadcast every second Friday of the month at 10 a.m. on both platforms simultaneously. We will provide the link to our channel in the description of this video, or you can write down the address that may display on the screen and also in our comments section. We're very excited about this new direction, and we hope that you are too. Now, I'd like to invite you to do a short mindfulness exercise, which can help to reduce daily stress. For best results, you can practice this every day. And before beginning, I want to remind folks that if any sort of emotions or feelings come up in your body that feel uncomfortable or unsettling to you, then please take care of yourself and go slow, or you can stop completely. Let's begin by sitting up straight, rolling the shoulders up to the ears and towards the back, and drop them there and relax. Bring your attention to your breathing. Relaxed breathing in and out of the nose, and you may close your eyes to keep out any visual distractions. And it's also a wonderful way to start looking inward towards your thoughts and your feelings and bodily sensations. Continue breathing normally, nothing forced, just observe the breath. And keep your eyes closed while you take your right hand and place it on your belly. And notice how the belly rises and falls as you inhale and exhale. Do this for a few breaths. And now you can put your left hand on your chest and stay here for a few breaths. While you have your hand on your chest and on your heart, feel free to say some positive words to yourself. It can be anything from, I love myself and all that I bring to the world. I am perfect, exactly how I am. I'm worthy of love and deserve to be treated with respect. Say anything to yourself that you need to hear right now. And you may not always hear comforting or positive words coming from others. So this is a time for you to be your own best friend. Rub your chest a little here and feel yourself calming down as you say these sweet things to yourself. Now bring your hand back into your lap and stay here breathing normally. Check in and see how you feel after saying these positive words to yourself. Does it feel awkward or does it feel kind of nice? Do you feel guilty for taking time to love on yourself? Or are you open to receive these words? Breathe normally and gently open your eyes with a few blinks. Feel free to jot down your thoughts after this very simple yet powerful way to start the day. Thanks for joining me yet again in this wonderful self-affirming mindfulness journey. Now let's get into the bulk of our show for today. You may all have heard about monkeypox and how it's a disease caused by the infection with the monkeypox virus. This week, the city of Austin and Travis County has declared monkeypox a public health emergency as the number of cases continue to rise. We encourage you all to join us to help stop the spread of monkeypox in our community. And the virus can be spread from person to person through the following ways: intimate physical contact, such as kissing, cuddling, wrestling, or sex; direct contact with the infectious rash, scabs, or bodily fluids; respiratory secretion during face-to-face contact; touching items such as clothing, towels, or linens that previously touched the infectious rash or bodily fluids. And pregnant women can pass this on to their fetus. The current monkeypox outbreak has not revealed any evidence of airborne transmission, but that doesn't mean that it can't or that it hasn't happened yet. We are monitoring the cases to give you the latest and best information that we can. Monkeypox is part of the same family of viruses such as the smallpox, but symptoms are milder and it's rarely fatal. Symptoms can include fever, headache, muscle aches and backache, swollen lymph nodes, chills, exhaustion, a rash that can look like pimples or blisters that appears on the face, inside of the mouth, and on other parts of the body, like the hands, feet, chest, genitals, or anus. The rash goes through different stages before healing completely. and it typically lasts 2 to 4 weeks. A person cannot spread monkeypox unless they have symptoms, and you are no longer contagious once new skin has formed. For most people, monkeypox is not fatal, and it will go away on its own. But some people with a weakened immune system, like having cancer, they may need treatment. And there is a vaccine available, but it is limited. So only those who have had a sexual partner in the past 14 days and who was diagnosed with monkeypox, or those who had multiple sexual partners in the past 14 days in an area with known monkeypox are currently eligible to receive the vaccine. If you have symptoms of monkeypox or you have had close contact with someone who has monkeypox, do reach out to your healthcare provider. If you do not have a provider, please call APH at 512-972-5560. And you should only get tested for monkeypox if you have a rash. Testing involves a provider taking a swab of a sore. Only your provider, not APH, can give you the test result. While you're waiting for your test result, which can take a few days, isolate yourself from others. Here are some things to consider to decrease your risk for monkeypox. You can protect yourself from monkeypox by being fully clothed and avoiding skin-to-skin contact with strangers, limiting close and or intimate contact to people you know. Close contact includes sharing items like clothes, drinks, blankets, and wear well-fitted masks in close spaces when social distancing isn't possible to reduce sharing mouth and nasal fluids for prolonged periods. Being aware of monkeypox symptoms, along with rash, symptoms include fever, headache, and muscle aches, chills, and swollen lymph nodes. We also encourage you to talk to your sexual partners and ask questions like, have you noticed any rashes? Washing your hands and using hand sanitizer often. And of course, staying home when you feel sick or when you experience any of the symptoms. APH will continue to share information with the community as the situation evolves. We have a website with all the information we covered today, and you may get flyers in multiple languages, including Pashto, Arabic, Nepali, Korean, Spanish, and English. And the website that you can get all of this information is at austin-texas.gov/page/monkeypox-media-resources. It will also be listed in the comments. And yes, COVID is still with us. We'd like to let you know vaccine clinic at Sims Elementary School is now closed. APH still operates a testing site at 𝗪𝘁 Elementary from Tuesday to Saturday, 11 a.m. until 7 p.m. The tests are free and no proof of medical insurance or residency is required. Free rapid antigen tests are also available for pickup at the 𝗪𝘁 Elementary testing site. Stop by during regular hours of operation. And of course, no appointment or ID is required. For more information about where to get the COVID vaccines, you can visit vaccines.gov. And for more general information about COVID, you can always go to ausintexas.gov/COVID-19. Well, we've reached the conclusion of my API Live today, and I hope you leave with some valuable information that you can help to spread to people who might not know some of the things that we've mentioned today. Remember that APH recommends wearing masks when indoors in public spaces, social distance when necessary, wash your hands, and stay home if you feel sick for some well-deserved rest. And here's an extra tip for maintaining your wellness throughout the day. Take lots of breaks, drink lots of water, and breathe when you feel overwhelmed. I hope that you'll join us here on Facebook or on our YouTube channel next month on September 9th at 10 a.m. Be safe, be well, and be kind to one another. Thank you for joining.